Breaking news as we bring you the very last Madison County COVID response update.
Let's get it started. Let's
Chairman
listen in.
Dale Strong, Huntsville area government, healthcare, and emergency response agencies. We bring you this weekly briefing on our community's response to COVID-19. Our speakers today will be Dr. Karen Landers from the Alabama Department of Public Health and Chairman Dale Strong from the Madison County Commission. You will note that we are sitting at least 6 feet apart according to CDC guidelines, as well as our own best practices to separate and sanitize. At this point, I'll go over the current numbers. In the state of Alabama, there are 401,490 confirmed cases of COVID-19. In Madison County, there's 29,095 confirmed cases, having resulted in 380 confirmed deaths. We continue to monitor this and respond accordingly. At this time, we'll go to our first speaker, Dr. Karen Landers from the Alabama Department of Public Health.
Thank you, Jeff. It certainly continues to be a great privilege to be able to serve the citizens of Madison County regarding the response to this pandemic, as well as the citizens of the state of Alabama. As all of you know, I do work statewide, but I have had a role here in Madison County as the Madison County Health Officer. We are reaching a very good place right now in Alabama and certainly in Madison County. If we look at our risk indicator dashboard in Madison County right now, we are in the low risk zone, and our overall percent positivity for test in Madison County is less than 5%. Our statewide percent positivity is 5.3%, and we haven't seen these kinds of numbers since over a year ago. So this is very, very encouraging, and I'm very pleased to see this. But with speaking to those indicators, I also want to continue to issue a word of caution, and that is that while we are seeing a decline in COVID-19 cases, we continue to see in Alabama the emergence of variants. As I've spoken about variants before, again, variants are mutations of the COVID virus, of the SARS-CoV-2 virus. Viruses mutate, viruses find ways to get around, if you will, the immune system and get around the immune response so they can continue to survive. As of our last data in Alabama, we had about 113 variants identified. But again, we don't sequence every specimen. We only sequence certain specimens, and we again know that there are likely a lot more variants, specifically the UK variant. But the variants that we have seen in Alabama, the UK variant, the California variant, we've had a few of those cases. We have had one case of the South Africa variant. And all of these variants have the potential to reverse course in what we are doing. Right now, our vaccines do appear to be effective against the variants, but there's specifically one variant, again, the variant from Brazil, that appears to not be very receptive, if you will, to the use of monoclonal antibodies as a treatment, and monoclonal antibodies have become a very important part of management of certain cases of SARS-CoV-2. So again, the variants find a way, and as we have more persons vaccinated and more persons with immunity, we have to be aware that the viruses are still going to try to find a way to survive. So we need to be vigilant in our own practices and being vaccinated as soon as we're eligible to be vaccinated, and also at this time continuing our mitigation standards, our very strong recommendation for our ongoing practices of social distancing, physical distancing, if you will, of our respiratory hygiene, hand washing, hand sanitizing, and the use of a mask. It's not time to abandon this. We need to go further down the road. We need to, again, have higher rates of vaccination, higher rates of immunity, if you will, prior to abandoning the use of the mask. And again, this is very, very critical as we reach this juncture. Now, I want to speak to vaccination. Again, certainly vaccination has been challenging in the situation that we've been in, because we started out with a relatively small amount of vaccine, and certainly one of the products was a bit more difficult to handle. We have been able to adapt to the cold chain management of the Pfizer product, and we are using a lot more Pfizer now in the state of Alabama as we have more providers able to manage the cold chain product. Of course, we have the Moderna, and then also the Johnson & Johnson vaccine. But we went from having about 40,000 doses of vaccine in our first allocation to the state of Alabama to now this week having over 150,000 doses distributed. I do think that that's going to go down a little bit next week, because we are getting some Johnson & Johnson this week that we will not necessarily get on a regular basis until that production ramps up. Now, Alabama gets a lot of criticism in, many ways in news, in the national news, about, what we're doing in again, many different parts of the state. But I want to speak to something that's not really been highlighted in the news, but it is published in the MMWR, the Morbidity and Mortality Weekly Report from CDC, and that is Alabama ranks 9th in the nation in vaccinating its most vulnerable citizens. And that is a very, very good metric. And I also want to remind that the amount of vaccine allocated versus the amount distributed, and by that I mean the amount available to Alabama versus the amount that we actually have ordered and brought into the state, that the margin there is actually very small. Pretty much what's allocated to us, we order it and we get it into our state. Now, we are working diligently to ensure that all the persons that are Imprint approved providers will have vaccine, and we do expect that to happen this week. So we're going to have more providers in the state of Alabama able to give vaccine than ever before. And we're already starting to see that as more providers become available, again, persons have more choices, and we've even had people to cancel their health department appointment because they were able to get their vaccine at a retail pharmacy. Again, the federal government has brought on more retail pharmacy partners, and even Winn-Dixie is now going to be a retail pharmacy partner in some parts of the state of Alabama. So again, we're having more providers, more entities become available to give vaccine, and that is very, very useful. Now, if we look at what's going on in terms of percents of persons being vaccinated, keep in mind that in Madison County that almost 27% of persons in Madison County have received at least one dose of vaccine. And that is a very significant number. That is really a number that we're very proud of. We have about 35 counties in the state of Alabama that have vaccinated over 25% of their population with at least one dose. And again, keep in mind that most of the vaccine we use is 2-dose vaccine, because we have a lot more of that coming into the state. So I think this speaks well to persons' acceptance and uptake of vaccine. But in closing, I want to remind people that we will need vaccine rates much higher than 25, 26, 27%. We will need vaccine rates, again, significantly higher. It depends on which infectious disease physician you listen to determine what that percent actually needs to be. But my hope is that every Alabamian who is eligible for vaccine, and again, currently vaccines are only approved for 16 years of age and above. But it's my hope that every Alabamian who is eligible for vaccine will take advantage of the opportunity to take this free, safe, and effective vaccine to protect themselves against this deadly virus. I mean, we've seen the devastation. We know the devastation. Just a couple of days ago, I had someone that I know extremely well to let me know that a family member, a very close family member, had passed away from COVID. again, someone that I had talked to a few weeks ago when the family member became ill with COVID. And we had concerns that this person might not do well, and indeed they did not, and they passed away. And they're a resident of here in Madison County. So again, please take your vaccine when it is available to you. And in the interim, please continue to follow these mitigation standards that have brought us to where we are today in Madison County. Thank you very much.
Thank you, Dr. Landers. And now we'll go to Commission Chairman Dale Strong, Madison County Commission.
Thanks, Jeff. Good afternoon. I'm Dale Strong, Chairman of the Madison County Commission. It's an honor to come before each of you today to offer the latest data and information related to COVID and our joint response. A little more than 56 weeks ago, on February the 28th, 2020, elected leaders from our greater Madison County area, along with healthcare and business leaders, held the first press conference to address North Alabama on COVID-19. We knew that based on what we were seeing throughout the country, our response and plan for this community must be swift and deliberate. Our team began these briefings with one objective: to share the latest information about COVID-19 and how to protect yourself and your family. These briefings provided a comprehensive platform to share details about the number of COVID cases in Madison County and our region, along with vital measures to ensure that we did not inundate our local healthcare system and the healthcare providers and medical facilities throughout our community. While our team worked together to manage this pandemic reaching Madison County, this community joined us in answering the call to take care of our families, neighbors, and friends. Think back to just a year ago when sewing machines were fired up to make homemade masks, 3D printers were cranking out face shields, local companies modified ventilators to work for more than one patient. We all pitched in to take care of each other during this unprecedented time, coupled with an uncertain future. But I'm also thankful today, along with Mayor Battle, Mayor Finley, to the hospitals and emergency services leadership for being an integral part of Madison County working to win this fight. To David Spillers and the Huntsville Hospital System, its 14,000 employees, physicians, nurses, and staff, Madison Hospital President Mary Lynn Wright, Dr. Pam Hudson, and the entire Crestwood medical team of healthcare providers, John Howell and the HIMSI paramedics and first responders, Madison County volunteer fire departments, Huntsville Fire and Rescue, Madison Fire and Rescue, Dr. Karen Landers, Judy Smith and their team from the Alabama Department of Public Health, General Ed Daly and Redstone Arsenal Command and Control, and also to Jeff Birdwell with the Huntsville-Madison County Emergency Management Agency. Thank you to each and every one of you in uniting as one voice to care for Madison County during a pandemic like we have never seen before. As healthcare and emergency professionals, you never wavered and you remained steadfast in your work and commitment to providing the highest level quality health care for our community and our region. Many of you spent days away from your families to ensure the health and safety of your loved ones, so you remained able to care for those most vulnerable and to save lives of those faced with fighting COVID in hospitals. And I'd especially like to thank the residents of Madison County for allowing us to share critical information and vital data, and for being part of our team to combat COVID-19 right here in Madison County. I'm proud to report to you today in North Alabama, our numbers are positive of COVID cases continues to decline. After experiencing 2 periods of spikes in cases last summer and during the holiday season, Madison County is now seeing the lowest number of new daily cases since June of last year. Today's 7-day average of new cases in Madison County is 20, also the lowest since June of last year. Today, we have 35 inpatients in Madison County hospitals being treated for COVID. Of those, 8 are in the ICU and 4 are on ventilators. As of this morning, Huntsville Hospital, Madison Hospital, Crestwood Medical Center, along with our local our health department, has administered just over 122,000 vaccines here in the greater Huntsville-Madison County area. This represents about 33% of our entire county population. We continue to work with local, state, federal agencies to increase our allotment of vaccine to ensure Madison County residents who desire a COVID vaccine has access. The Alabama Department of Public Health is working hard to carry out their comprehensive vaccinations throughout the state of Alabama, and we know there's still more work to do. But rest assured, our local team remains committed in working with the Alabama Department of Public Health to get vaccines in the arms of those who seek the vaccine. Today's briefing is scheduled to be the last of these weekly updates. For the last 55 weeks, we have all faced challenges unlike any we have ever experienced before. Whether you worked from home, helped your children with school, cared for a loved one or a neighbor, there isn't anyone I know who hasn't been touched by COVID over this past year. But as this community has done before, and we will no doubt do again, we have united to face this threat of COVID together, and we are better because of it. Now, more than ever, I know our best days are still ahead, and we strive to return to post-COVID normal. This Easter weekend, hopefully many of us can spend the holidays safely gathered together in our places of worship along with family and friends. These small steps forward can help each of us celebrate what we have overcome and unite us together. It is my honor to serve as your chairman of the Madison County Commission. He is risen.
Thank you, Chairman Strong, and thank you for watching today. As Chairman Strong mentioned, this is our final scheduled briefing. As the need arises, future briefings will be scheduled. We do ask that you monitor the City of Huntsville's COVID-19 webpage as well as the websites of our other partners for critical updates. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As you come to the microphone, please identify yourself and who you're affiliated with.
Good afternoon, Dallas Parker with News 19. My first question is for Chairman Strong. We're already hearing from business owners who are pleading with customers to continue wearing masks after the mandate ends April 9th. How do you encourage the public to respond, and where do you see the balance in people wanting to require it and people's right not to?
I think each person has to take their own health, their own whatever's going on in their family. As chairman of the third largest county in the state of Alabama, I will be joining with Governor Ivey and also Dr. Scott Harris. I believe that we're moving forward, but there are situations that people have different health care needs or requirements, and they've got to make their own decision. They don't need government making that decision. I believe that we have moved through this pandemic in a great way. We're stronger because of it, but again, I think that we're moving in the right direction. Our effort from day one was to keep our hospitals from being inundated with COVID cases, filling our ICUs up, overusing ventilators. Right now, our physicians, our health care has done a phenomenal job, and I think that's what has led to where we are today.
Thank you. My next question is for Dr. Landers. You discussed quite a few positives today and a few risks we still face, but of course there are still concerns surrounding the state's overall vaccination standing, according to the CDC, 51st in the nation, including Washington, D.C. Can you address why you think we're in that place and what's being done to promote improvement right now?
Well, again, Dallas, as I mentioned, the areas that Alabama is doing extraordinarily well. And again, looking at the vulnerable citizens, and everyone can get COVID, don't misunderstand me, but to be ninth in the nation for the number of vulnerable, I think speaks well to our providers and to the allocation plan that we have followed, which is based upon the Advisory Committee on Immunization Practices. I mean, we know that if we look at the geography of our state, you know, we have urban areas, we have rural areas, and we have areas that persons want to receive vaccine, but they have transportation issues or other challenges. So we continue to work with a number of I guess you might say plans, for lack of a better word, and ways to execute those plans to ensure that persons throughout the state have access. Just for example, our National Guard troops working in our counties with the highest social vulnerability index. And again, as I mentioned to you, as of the end of this week, every provider in the state of Alabama who is an Imprint approved provider and wanted to give COVID-19 vaccine will have vaccine in stock. So, you know, we're on a steady trajectory. And while initially we started out not only with a slightly lower allocation of vaccine, but less ability to get that vaccine out to persons because we just did not have the numbers of providers and the number of staff to give the limited amount of vaccine that we had. This put us again at a lower starting point, but we are on a steady onward and upward trajectory. And again, as I mentioned, if you just look, I mean, we've been doing this 3 months, but if you look at where we are today, you will see that we have gone up, up, up. And just to remind that, again, the state of Alabama, we actually distribute more of our allocation than a number of other states do, as far as, again, what is allocated to us and what we actually order. We're actually kind of in the middle of the pack in terms of distributing what is allocated to us by the federal government. So again, we are not in a race with other states. We are in a race within our own state. And our focus is the citizens of Alabama. We have wasted virtually no vaccine in the state of Alabama. As I have told people, about 110 doses out of about about 1.6 million. And that has been where we couldn't pull a 6th dose out of a Pfizer vial, or we had a few syringes where there was leakage of the hub at the end of the syringe, so we couldn't use that dose. So, I mean, this has been a phenomenal effort on our part not to waste any vaccine in our state. So I feel that we, again, are in a very good position. We are moving forward. We are working hard to get the vaccine in arms. There are clinics every day that are going on in the state of Alabama. And I do expect that we are moving closer, much closer to being able to open up vaccine to persons 16 years of age and above, regardless of medical condition. I think we are moving very close to being able to be to that point. So again, while our ranking, if you look at our ranking, it is 50th, but if you look at the percentages that are separating us, it's actually, tenths of percents. It's very, very, very small. So we are, again, committed to our citizens and what's going on in our state. Thank you.
Thank you, and thank you all for being here over the past year.
Thank you.
Bridget Divers, WAAY 31 News. I have a few questions for you, Dr. Landers. So the CDC director, she warned of an impending doom and a 4th spike of COVID cases. I mean, we're at the lowest cases we've ever had since last June. So how are you feeling knowing that she thinks we're going to have a big spike again in the coming months?
I have great respect for our new CDC director, as I did for our previous CDC director. And we are poised to go in the direction that we as Alabamians want to go. I mean, this is now within our control. It's within our grasp. I'm a physician. I give medical advice. And as I tell people all the time throughout this pandemic, and even with other medical conditions, I give medical advice that I hope you will follow in order to protect your health and well-being. But we have a choice here, and that is to vaccinate when we're eligible to take our vaccine, and we have a choice to wear our mask, to physically distance, and keep our hands clean and keep our environment clean. We have a choice here. And as a physician, I am going to speak to the citizens of the state of Alabama who are the patients of the Alabama Department of Public Health. We consider our citizenry to be our patients because we're in the business of prevention. And my medical advice is get your vaccine and wear your mask and carry out your other mitigation standards so we will not experience that additional wave of COVID. Again, it's our choice. It's our choice as Alabamians. Thank you.
Right. And Pfizer, they announced this morning that their vaccine is actually 100% effective for kids and teenagers. What does that mean for us trying to make sure that people in our state don't get the vaccine, especially kids that are around other kids all day in school? How are you feeling about that?
Well, I'm a pediatrician, as you well know. I also obviously work in infection control, and that's how I wound up here. So I'm very excited about that data. And it is something that has been discussed quite a bit among we pediatricians. Of course, keep in mind that Pfizer has not yet received EUA for that age group, so ACIP has not yet provided guidance. But I'm very pleased to see that data, and it's really in keeping with what a number of pediatric infectious disease physicians have been stating, and that is certainly by summer or fall, we should be ready to vaccinate kids in the 12 and above age group. Again, awaiting obviously the EUA and the CDC ACIP guidance on that. But I'm personally very excited about it because, as I mentioned to you, the statement that, again, a pediatric ID said to me not too long ago is these viruses like to find a place, and if we have a reservoir, such as an unvaccinated group of persons or a group of persons that are unable to be vaccinated because there's not an eligible product, then the virus will find that as a reservoir to continue to survive. So I'm very pleased with the data, and I look forward to the EUA being put forth and to guidance from the ACIP. Thank you.
Thank you, Dr. Landers, and thank you everyone for being here over the last year. Appreciate it.
Good afternoon, everyone. Elizabeth Gentle, WAFF. Dr. Landers, this question is for you. So we're talking positives here with the vaccine and people, trying to get the vaccine in people's arms, but there are groups of people out there who do not want to be vaccinated. They do not want to receive the COVID-19 vaccine for whatever reason. They feel like the data is not there to tell them, whatever side effects they could have. For whatever reasons, they don't want to be vaccinated. What would you say to those people who are anti-getting the COVID-19 vaccine, and what danger does that put them in and others that they're around?
Well, first of all, again, being a physician with experience in vaccine-preventable diseases, this is not the first time that I've had someone that is hesitant or reluctant to take a vaccine product. Again, I've had a number of questions asked through the years related to other vaccine products, and I think if you look at data on vaccine hesitancy versus refusal, the actual numbers of people who ultimately refuse a vaccine once they have their questions answered is really pretty small. It's really only a couple of %. So what we're talking about here is that hesitancy does not equal refusal, and I've actually been saying that over the last number of days, but hesitancy to me as a physician means that persons need more information. Certainly there are a number of vetted sources for information, not just the CDC, but also the American Academy of Pediatrics, the American College of OBGYNs that specifically addresses questions related to pregnant and lactating women, the American Academy of Allergy, Asthma, and Immunology has a wealth of information related to not only the vaccine product, but any concerns or really questions about contraindications, and again, a lot of other vetted sources besides, as I said, the CDC and the Alabama Department of Public Health, among others. So the first thing I do is to urge people to ask your questions. But ask your questions of persons who have training and experience. I mean, I receive my medical information from medical providers, from scientists. I receive other information related to other topics from persons who have expertise in those fields. So ask your questions, do your research with vetted sources, and be prepared to change your mind. And we had this happen actually in our long-term care experience in vaccinating, that persons who initially were reluctant when the federal pharmacy program came in and vaccinated patients and staff members, and there were persons that were reluctant. By the time they came back to give the second dose, some people had changed their minds, so they had to schedule additional time. So we had additional uptake once persons, first of all, received more information, had opportunity to look at scientific information, but also had the opportunity to see other people take the vaccine, tolerate the vaccine, and do well. So we've actually seen a reduction overall in vaccine hesitancy, and that's what I hope will happen. But I encourage people to, please ask these questions and please look at the information that is out there from scientists, persons who have studied this. This vaccine actually, these vaccine products actually have gone through rigorous clinical trials with hundreds of thousands of persons. The vaccine is a safe, effective product. I took the vaccine myself. My daughter took the vaccine. My other daughter is awaiting her opportunity to take the vaccine. So, again, I think that we just have to continue to share our experience as clinicians and to share our experience as citizens in taking the vaccine product. Thank you.
Last question. April 9th, the mask mandate expires. People are probably going to toss the mask aside if they want to and not wear it. Concerns that you have now that there is the option that the mask does not have to be worn, concerns of numbers and positive cases.
Well, Elizabeth, as I mentioned earlier, I am concerned about the variants. We've talked about why the variants are more contagious. Obviously, the variants, certainly the UK variant has been particularly successful in mutations around the spike protein, and the spike protein is actually where if you look at the way the vaccines were developed, it really targeted the spike protein. So I'm very concerned about that, but as I said earlier, I'm a physician. I'm telling people as a physician to take medical advice. A mask is really a medical, I guess you might say a medical piece of equipment, a piece of PPE, if you will, personal protective equipment. So I'm advising people that until such time as we continue to see a downward trajectory for a period of time that we can feel comfortable that the virus is boxed in, and by that I mean because of immunity and also a low transmission rate, continue to take the advice of your healthcare professional and protect yourself and protect your community. Thank you.
I echo what my fellow journalists have said. Thank you all so much for what you've put in for the last 55 weeks of keeping the public and us updated. We really appreciate it. Thank you.
Thank you.
Paul Gaddis from AL.com, and I just wanted to get a comment from all three of you, if I could, about the fact that this is the last briefing, and maybe just what y'all, why these briefings over the past year were so important, and do you sort of consider this to be a milestone in fighting this pandemic, that we've reached a point to where we're comfortable at ending these briefings?
Well, I guess I'll start off. Yeah, I think the briefings were very important, especially early on, because we were able to give information to the public on what they could do, how they could protect themselves, which I think in the end made, our effort, our response a lot more successful. Why now? I think if you just look at the numbers, Chairman Strong mentioned the 7-day average. That's 20. That is the lowest it's been since the very beginning. So, and we've seen those numbers consistently stay there over the last, several weeks. So, I think it has become a point that the numbers are consistent, and we're able to manage those numbers, especially the hospitals and the healthcare system. So, I think it's time to, give it a break for a little bit. Now, that doesn't mean that we can't come back, if the need arises, if the numbers start to spike again, we certainly have the option that we can come back and do the briefings again.
Paul, the way I look at this, it doesn't change our day-to-day work. I mean, I'm going to be doing the same thing every day. I know that Jeff and Chairman Strong will be continuing to carry out their duties every day. I will still be managing the medical aspects of this response and looking at data every day and really devouring the science that's there in terms of this virus. The way I see this as being the final briefing here in Madison County at this point in time is that we really are at a very stable point here in Madison County, and we are at a point that the success of this community, of this county in terms of vaccinating continues to, again, move upward, and the numbers of cases going down. I really think that what we are looking at here is just continuing to focus our efforts on protecting the health and well-being of the citizens, but recognizing that our message is pretty much the same, and that is get your vaccine, and reduce your risk of getting COVID. So I don't think we have anything new to bring at the moment, but if things change, and frankly, I hope they don't. I hope that we continue to get better and better and better. But if things change, that is certainly something I can say absolutely about working with this team in Madison County, Huntsville City, Madison City, and again, the entire surrounding, that they have been ahead the whole time. I mean, I think of the very first contact that I had as a health officer working here. You know, this community has just been out in front of this the whole time and pivoting and changing and adjusting as the situation demanded. And so I expect that same proactive approach should we need to develop any new response. Thank you.
Paul, I commend the members of the Madison County Commission, Mayor Battle, the City Council, Mayor Finley, his City Council. We were traveling an uncharted path whenever this pandemic broke. The big thing that I've always said, our objective was to be sure that we didn't inundate our hospitals with so many patients that we didn't have the healthcare providers there to be able to take care of them. That objective, we reached that objective. Wasn't easy. You start thinking about some of the objectives that we had early on. We wanted to be sure we knew how many ventilators we had here. We wanted to be sure that if we had to take additional space, we were prepared, but again, you're never, every situation is different. I think that right there is understanding that immediately we knew we had 450 ventilators available, and not only did we utilize those here locally, we had other hospitals within the state of Alabama that may not have been as prepared as we were, that we also assisted those hospitals. I also believe that it was a turning point whenever the hospitals understood from the data that we already had, the testing had to be done outside of our hospitals, except for those patients that were critical. We were an anomaly for several months there where our caseload was a lot lower than other places in Alabama and also in the southeast United States. That was because they thought outside of the box. They set up at John Hunt Park, they set up on Governor's Drive, and they took those patients that had COVID-19 and other things, tested them outside rather than transmitting it throughout our area. So I commend those that helped in those decisions to make that happen. But I also commend Huntsville Utilities. You think about it, we didn't have power outages, very few, if any, during this year. You can't imagine. Those are things that you think about when you're in my position is, hey, what's the next situation that's going to happen in the middle of a disaster? But I do want to tip my hat to Huntsville Utilities. And then you think about our school teachers. Man, every day, wondering what has to be utilized next. You look at our workers, you think about it, Redstone Arsenal has workers from 17 different counties that commuted every day here for work. We found out what broadband meant to our community, and there's many throughout Alabama and some in North Alabama that don't have broadband. We functioned in many cases, our teachers, our engineers, and then you look at Hudson Alpha, some of the things that were done there that benefited the entire country, if not the world. So we navigated this. I commend everybody because it was rough. Everybody knows it. We're not totally out of the woods yet, but we're definitely a lot closer than we were a year ago. And if something changes, you can rest assured, Mayor Battle, myself, Mayor Finley, the Department of Public Health, and our EMA, we will step right back up to the mic and give the people the information so they can make a decision on what's best for them and their family.
I'll just close by saying I hope this is the last briefing and there's no need to call anymore. So thank you all.
At this point, we'll end this press conference. Thank you for coming.
55 challenging weeks of important briefings, and you just watched the very last Madison County COVID response update. However, as the need arises, they do plan to bring you future updates. Dr. Karen Landers, you just saw her leading off the last update, saying we are reaching a very good place in Alabama, and Madison County is currently in the low-risk zone. Overall, the COVID positive rate here, less than 5%. We haven't seen that rate in a year. But Dr. Landers is still warning about the potential for COVID variants that could spread, she says, and the potential to reverse the course that we're already seeing. She does warn that this is not the time to abandon wearing masks, even after the statewide mask mandate. Even the local mandate expires April 9th. Dr. Landers also said the vaccines seem to be working. She encourages you to be vaccinated whenever you become eligible, and she does say that we're very close to vaccinating those 16 and over. And Lyndon, as we wrap up the very last Madison update, Dr. Landers put a positive spin on the negative news reports critical of Alabama's vaccine output. She says the state is 9th in the nation in vaccinating its most vulnerable population, but that all in all, we could do a better job and still do better in getting every Alabamian vaccinated.
Yes. And Madison County Commission Chairman Dale Strong just reiterated how thankful he is for the frontline workers in Madison County for everything they've sacrificed and have done this past year. Here's a number to look out for. Strong says the number of positive cases have declined in Madison County, and we're seeing the lowest number of new daily cases since last June, with 20 positive cases a day on average. 122,000 vaccines have been administered in the greater Huntsville area. So that was the final briefing again, Pat. Like you said, they will come back. It could not be goodbye forever. If something else comes up, they're going to be the first to make sure people in our area stay informed.
Well, that wraps it up here. We'll have the latest news coming up today at 4. We hope to see you then.